thinking about caring for a patient, my approach has always been not to treat an illness, but to really think about the whole person. This probably goes back to some of my personal experiences growing up with somebody that I knew who had seizures. My aunt had epilepsy, and I saw the struggles that she had with her seizures and really some of the problems that were associated with her seizures. Probably the best way to describe my approach when it comes to epilepsy, maybe in a very few words, is just a team approach. And that team is made up of other neurologists, neuropsychologists, very often neurosurgeons if a person is considering brain surgery for their epilepsy. There's a whole host of nurses and other people that are involved in the person's care. And we're really all working together to get to the point where the person has ideally no seizures and no side effects from any of the treatments they're considering. So having done this for a lot of years, I've had the great opportunity to meet a lot of amazing people. And one is a young lady whom I still see. She had an injury to the brain, a traumatic injury. She was playing baseball and was struck in the head by a baseball bat. And that caused a brain injury and later seizures. With the newer technologies, she was somebody who benefited from one of the new devices. This area is called neurostimulation or neuromodulation. And what it really means is an area where devices and essentially electronic devices are now being merged with the brain in order to control and modify seizures. And a lot of that has to do with innovations in technology and computers, making devices and computers much smaller so that they can be placed inside implanted devices and useful for very complicated medical illnesses like epilepsy. She used to have something like 50 seizures per day, and with this device, she now has about 3 seizures per year. And so this has had a tremendous impact on her day-to-day life, let alone her ability to return to work and enjoy vacations without having to worry about seizures, spend time with her family and her nieces, whom she adores. These are the kinds of things that before would worry her on a day-to-day basis. Weill Cornell Medicine stands out in many ways. I think the first and foremost way that it does is, in keeping with my own philosophy, is to treat the whole patient and really to consider all of the aspects of not only a person's medical illness, but how it might affect their day-to-day life, and really how, as a team, we can work on all of these aspects to get the person to the best possible place they can be.